This includes having robust evidence and data gathering systems to collect, analyse and use accurate data to inform effective policies and programmes at local level. Our programmes address these gaps and ensure an effective bridge between national and subnational data systems and local service delivery. For example, our programme in Guatemala has worked to strengthen disability data systems in the municipality of Camatan, to accelerate service delivery across sectors through the integration of Washington Group question sets into the administrative registry and embedding inclusive training into workforce competencies. Programme partners have conducted surveys and applied georeferencing tools with the local organisations and persons with disabilities, Rompiendo Límites and Vivamos Mejor, or Breaking Boundaries and Living Better. And through that, they've been able to register an additional 713 persons with disabilities to community services as a result. So the importance of localisation and accelerating both service delivery and the meaningful engagement and participation of OPDs in all development processes is central to the fund's strategic thinking. We're finalising our new 5-year strategy, which is placing working at city level through the Resilient and Inclusive Cities Hub, launched at the Global Disability Summit in Berlin, and localization and strengthening service delivery and data systems at subnational level, really at the heart of what we do. Crucially, this includes deliberate funding and technical assistance to work with local communities, persons with disabilities and their representative organisations to help shape and monitor the change our programmes are trying to deliver, and systematically report back to us on how we can and should improve our approach at local level. So I think this session today will help us explore how all development partners can better monitor social development and inclusion at local level, and we very much look forward to the discussion. Thank you.
Good morning, everyone. Thank you so much, Alfred, for your intervention. My name is Claudia Caps. I work for UNICEF in the division of data, where I'm responsible for statistics related to children with disabilities. I've been asked today to be the moderator. I'm obviously very pleased to have this role, but I also feel slightly hypocritical because I normally tend to speak more than the time that is given to me. So I'm going to try to see if at least for a day I can make other people enforce rules that I'm the first one to break. Yeah. So without further ado, to make sure we go smoothly into the program, it's my pleasure to welcome now Elizabeth Lockwood. Elizabeth is CBM Global Representative at the United Nations, where she develops advocacy strategies to raise awareness, strengthen capacity, and lobby for the rights of persons with disability. Elizabeth has been working specifically on data, on promoting the use and the availability and quality of data for persons with disabilities. So she brings the wealth of expertise of bringing together the data, passion and knowledge together with the activists. Elizabeth will also share her time with Kasper Bergman, who is from Denmark and Vice President of the World Federation of the Deaf. Is working as the head of international cooperation at the Danish Deaf Association, overseeing development partnerships in over 10 countries globally. So I'm very pleased to start with this intervention. We both have 10 minutes. The floor is yours. Thank you.
Thank you, Claudia. And thank you, everybody, for coming today. I'm very pleased to be here speaking. There are significant data gaps for persons with disabilities, as we all know, especially those of you in this room. And one way to address these gaps is through an intersectional approach and using citizen data. So I'll be talking about citizen data today, and particularly led by organizations of persons with disabilities. Citizen data defined are data that individuals, communities, or their organizations produce to directly monitor, demand, or drive change on issues that affect them. And citizen data produced by OPDs can critically fill data gaps, especially in that intersectional lens that I mentioned, and in particular, partnering with national statistical offices in an atmosphere of co-creation and co-ownership. A little bit about citizen data. Citizen data are increasingly being recognized as a complement to official statistics to measure especially things like the Sustainable Development Goals or the Convention on the Rights of Persons with Disabilities. Citizen data are generated in many ways, including surveys, telephone calls, emails, reports, storytelling, and even social media. Citizen data can be quantitative or qualitative, structured or unstructured, and open or closed. But very importantly, citizen data are a useful complement to institutional data, but not a replacement. I think that's very important to emphasize. Citizen data are often local or community-driven data. As an example, last year in Bolivia, with the International Disability Alliance, we co-facilitated a training on data advocacy to 35 organizations of persons with disabilities. And what we learned from that training was data do not reflect the reality of the lives of people with disabilities, especially at the local level. Most communities are collecting their own data, but don't really know what to use it for or how to complement it with the government. Most data being collected have never been collected before, so this is really important, especially looking at human rights, such as access to health, education, accessibility, and language, even within persons with disabilities' own families. And even when OPD leaders connect with government officials, very little changes. So there's a lot of work to be done, but there is positively a lot of increasing data projects between citizens and national statistical offices with initiatives like the Collaborative on Citizen Data. And this is multi-stakeholder in nature. And so we are part of it. And then we have the UN Statistics Division and other NGOs like Open Data Watch. And this is a real excellent example, I think, that we can replicate and strengthen. And now I'm going to hand over to Casper, who will share another example. Thank you.
Let's proceed. Let me start over. The World Federation of the Deaf is an international non-governmental organization that represents and promotes approximately 70 million deaf people's human rights work worldwide through our advocacy work with 138 organizations, which are national deaf organizations. In our work, we have discovered that there's a lack of data on deaf people and their experiences. For example, we want to know how many deaf people are native sign language users. That kind of information is non-existent, yet it's essential to have effective public policies, which will guarantee our exercise of rights. As a result, the World Federation of the Deaf supports deaf-led research to collect data on deaf people that otherwise would not have been collected. Very few deaf people participate in general surveys on persons with disabilities. This is because there are no surveys in national sign languages and because of a lack of cultural awareness of deaf people. Deaf-led data collection is especially important for deaf people as minority language users of national sign languages. Thank you so much, CMB Global, who has provided financial support for us to carry out deaf-led, citizen-generated, and intersectional research in Bolivia on barriers for deaf Indigenous women and what they encounter when they access healthcare services. The data collection is powerful, and it's important, since these women are among those most left behind by the intersection of deafness, gender, linguistic identity, and indigeneity. Our data found from the 20 Indigenous women who were surveyed multiple points. I'll share them with you now. Vastly, the majority were raised by hearing families without any sign language access in their home And most of their hearing families of deaf people do not learn sign language for those family members. Those Indigenous women have no access to sexual or reproductive health education. They're in a situation of poverty and limited education access. A little more than half in the data collection have healthcare coverage, yet they are unaware of family planning, and they may have unintended pregnancies. Because of their lack of education and access to it. The main communication barrier is a lack of sign language interpreters in healthcare settings and the lack of healthcare education in sign languages. Their testimonials highlighted powerful stories. All of the deaf women interviewed were victims of rape and abuse, and many did not even realize that it was abuse. The abuse was from family members and partners. Overall, they had a lack of health information, leading to greater health risks. They had a much higher risk of stigma and marginalization related to disability, gender, linguistic, and ethnic biases. Overwhelmingly, there was an absence of opportunities to seek help and assistance in their sign language. They depend constantly on friends and family for health information. They also depend on family members to interpret at healthcare appointments, which violates their rights to privacy. And often the family members interpreting could be the abuser of the deaf woman. They also highly experience misunderstanding and isolation within their own families. All participants were eager to receive proper sexual and reproductive health education through workshops in Bolivian Sign Language. This shows the necessity of providing culturally and linguistically appropriate health information in native sign languages. This example of citizen-generated data provides new data that has never been gathered before. Importantly, it highlights barriers and gaps that need to happen in order to affect policy change. In summary, I'd like to provide some recommendations from the research gathered. First, I would like to propose to the health authorities of Bolivia in conjunction with the World Bolivian Disordo, FEBOS, and the World Federation of the Deaf to provide informational sessions to healthcare staff on how to provide the highest quality of medical care for deaf people, including awareness on deaf culture and the use of Bolivian Sign Language. Next, I would suggest providing educational workshops in health knowledge for deaf women, particularly deaf Indigenous women, about their own reproductive and sexual health, allowing them to take charge of their own health issues in their native sign language, LSB. Third, I would highly suggest developing anti-autist and decolonial programs in hospitals and schools on how to work with deaf people, and the direct participation of deaf experts will be required to address gender biases. Thank you so much for your time.
Talk today about inclusive education management systems, the kind of data we need to try to ensure that all children, regardless of disability, receive the education they have a right to. When we think about data, when most people think about data and talk about data, they're usually referring to surveys and censuses and things like that. That's what first comes to mind. Something which I think gets neglected a lot is administrative data and the power of administrative data, its advantages, and how it can be used in a complementary fashion with survey data to give us a full picture of what's going on. So a good example of this, where a lot of work has been done recently, is with Education Management Information Systems, or EMISs. Now, if I want to look at the school system, I want data on several things. I want data on children with disabilities in school and out of school. I also want to know about the environment. I want to know about the accessibility and inclusivity of the school. And I want to know what barriers there are to receiving that education. When it comes to children with disabilities, I want to know how many of them there are, what kind of difficulties they have, what kind of supports they need, how that varies by age or gender, and importantly, how their outcomes are different from children without disabilities, or even among different types of disabilities. You know, which children are dropping out faster, not getting the education that they deserve. And one important source of information on this are EMISs. EMISs are, if they're run well, and they're not always run well, are censuses of schools. So every school gets asked to report on the children in their school and the environment in their school. And this is the data that the Ministry of Education uses to administer their system. And the EMIS works at multiple levels. It could work at the classroom and child level. Oh, this is a child I've identified as needing some sort of support. It works at the school level. As the school administrator, what kind of resources does my school need? What's happening in my school? How can I manage my school? And it works at the national policy level. And in terms of what's going on in the country, how do I plan for various interventions or improvements in my system? And one neat thing about administrative data that we often challenged by with survey data is when it comes to evaluation. Quite often we want to do an intervention. We say, oh, what's the comparison group? What's the control group? We have to go out and collect all this data before we even start doing anything. Otherwise, we can't have a robust way of seeing what happened. But if I have an EMIS that's collecting data on all the children, all the environment, and I do an intervention in that school, I already have my baseline. It's there for me right away. So it's actually, if you have a good administrative EMIS, you're set up really well to see what the impact is of your various interventions. What the EMIS doesn't have is information on the children who are not in school. So we can see, oh, that if a child with a disability gets to school, we can see how he or she is doing. What we don't see are the children who never make it to school. For that, we do need those surveys, those household surveys. But what's important is that the way the children are identified as having a disability in both systems are the same, right? If my EMIS asks you, how many children, does this child have a disability? And my household survey is using the child functioning module developed by the Washington Group and UNICEF, we can't make that comparison because we're not really identifying the same children. So if we have the child functioning module in, say, MIX or other household surveys, and we have this child functioning module teacher version, which is a adapted version of the CFM that's been tested and approved in schools, then we can actually say, oh, these children who are out of school and these children who are in school have the same functional difficulties, and we can make those comparisons. And we call this data harmonization, right? We want, wherever data is being collected in the system, whether it's surveys or administrative data, we want to have some core set of questions that are the same everywhere so that we can use those two different data sources together, and it makes them really powerful. It also reduces confusion, because as we all know, one ministry or one survey says disability is this %, another one says it's something else. And you say, what's going on here? You people don't know what you're talking about. But if we have a common set of questions, we can have a better understanding of what's going on. But we want to move beyond the data on the children. We need data on the environment. Now, already, most EMISs collect information about the environment, on the structures of the school, the materials of the school, the human resources in the school. It's all in those EMISs already. What we need to do is to make sure that as part of that information, we're asking about the accessibility of the school. We're asking about the human resources in the school, the materials in the school, so that we can get a full understanding of the environment in which the students are learning in. We can do this one of two ways. We can take the emis's as they exist now and tinker with them, and some countries have done this. Oh, we used to ask if you have a computer room. Now we'll also ask if it's accessible. This is not great. It's better than not asking. What's better, though, is actually designing emis's with questions that more accurately capture the various aspects of the school. And that is starting to happen. So again, some advantages of this administrative data is the entire population is in the programs. Every student, if the MS is being run right, every student in the school is being entered into that data. It's ongoing and sustainable. I don't have to raise money and say, where am I going to get my resources to do this survey? It's happening, and it's been happening. It's officially recognized data. So it's government's own data. They can't hopefully say that this is wrong. And it can also signal the importance of issues. So when we tested the child functioning module teacher version in Belize, a lot of the teachers were like, why would I ask these questions? You're asking me these questions. But as they were going through it, they said, I never thought about staying on task or having friends, as not being able to make friends as an issue that might be indicative of a child with a disability. And you're asking me if my toilet is accessible in the school. That signals to me that you care that it's accessible in the school, and I'm going to get downgraded if it doesn't show up. So the very act of asking these questions, I think, does raise awareness. I'm trying to look how much time I have. Okay. Okay. So what's going on in the world right now when it comes to emis's? More and more countries are collecting data on children with disabilities. I did about 10 years ago, I reviewed 70, it was not a nice summer, 70 emis's, and there weren't a whole lot of them that asked about the disability status of children. Now it's a lot, right? It's probably more than half of them is my guess. Unfortunately, they're not using the child functioning module teacher version. So the quality of the questions identifying children with disabilities does vary. And what we want to do is we want to improve those questions. But the fact that they're asking about them now is good. There also have been gains in environmental data, though not as much. There's been much more effort on trying to monitor the children, but not look at the environments in which they're learning it. But again, even there has been there's some advancements. Like when I was down in Belize, I was very happy to see how many questions they had about the accessibility of the school. Were the teachers trained? In Fiji, they actually ask, do you have are speech therapists available? How often are they available? Are they available in your school, or do you have to bring them in, right? So they're really capturing, there are examples of places that are really capturing the resources, the environments that are there. So I think emis's are improving. I'm about to take part in a UNESCO course in Africa. We're trying to help several countries there improve their emis's. And I think it's not only good for emis's, I think it's also a good example for other administrative systems and for us to think about when we think about data. The surveys are super important, but the administrative data should be part of our attention should include that data as well. So thank you very much.
Thank you so much, Dan, for showing how the image can be an important data source of children with disability with the right adjustment that you mentioned. Now we're going to talk about surveys. We have the pleasure of having Ben Mayala with us, who is an experienced geospatial and data science professional with over 19 years of expertise and experience in applying geospatial analysis. Ben has been, until recently, served as senior geospatial advisor at the demographic and health surveys that, as we know, unfortunately, has been suspended. The DHS has been an incredible source of data across several indicators of well-being of children and families, including data on persons with disability. So Ben is going to show us how we can actually use survey data to model district level analysis. Thank you, Ben.
Yeah, thank you so much. So I'm just gonna show the advantage of trying to use new technologies to estimate indicators at a lower level. So, and people with disabilities, you know, they face so many challenges, and including multidimensional poverty, and their well-being needs to be monitored. And at international level, if you compare functional difficulties questions, you know, particularly from the survey, so they are increasing available at national levels and the population census. So this information can be used to identify, you know, people with disabilities, and of course also monitor well-being rights situation, and also measure inequalities and the gaps. So population-based surveys are designed to produce estimates at a national level, or also sometimes urban areas, and of course rural areas, and also, you know, sub-national level, we call admin 1 level. I'm going to talk more about that. So however, presenting such information at a national level, you know, we might miss some information that are very useful, you know, for like in the realization of human rights. So why we decided to do this, Sophie and other people in the team, we wanted to see how we can take advantage of the demographic and health survey data set, and see how we could estimate at a lower level, which we believe is useful for decision making. So DHS or demographic and health surveys, as you know, this is a national representative surveys. You know, it has been there for over 40 years. Until recently, we don't know the direction, but just to inform you, there's no DHS at the moment. So what we have done, of course, basically, usually we used to conduct, you know, large surveys from 5,000 to 30,000 households, and we collected so many data sets, like a lot of data set. When I say a lot, you're talking about over 1,000 indicators. And typically this data is, we collect after every 5 years, at least we'll go to a country and then collect a data set. So I just want to provide a quick overview, like what we define when we say what is admin 1 level, what is admin 0 level, and what is admin 2 level. So basically admin 0, that's the national, whereby it's very useful if you want to compare, you know, data from different countries. And also the audience for this particular data set is more international organizations, international policymakers, and the donors. Now, if you go to the subnational level, which you say admin 1 level, is more useful when you want to compare regions or provinces, and you want to evaluate, you know, what are the differences between, you know, estimate in these provinces. But if you go to a lower level, that's even more useful, the admin 2, because that's where programs are used to target different issues in those areas that have been affected. So what we thought, like, okay, what are the possibilities we can, make DHS or surveys more useful? We thought maybe if we increase the survey or we increase the population, maybe it could be one approach, or we could use the HMIS or data from a health management information system. But we realized that, you know, increasing the survey is very, very expensive, and also it's not feasible in countries with limited resources. But also, if you talk about the health management information system data, the quality is very, I mean, I think most of people, we can agree, like it's very, very low. I mean, I don't want to use the word poor, but it's not a very good data set. So we thought, I think if we have whatever amount of data and then use other information, I think we can produce something that is more useful. That's why we want to talk about the geospatial modeling approach to you guys. So this is a very simple approach. What we normally do, we use available data set. And the data set we're talking about, we we use the term geospatial covariate, just to make the term more simple. These are satellite image data set, and they're given at a pixel level, we say grid level. And a satellite image data set can be at a very high resolution, even up to, you're talking about meters. The advantage of satellite image data set, at least you have value like everywhere. It depends if you're talking about a 1 by 1 kilometer pixel, so you're going to have a value at that particular grid. So if you're talking about rainfall, temperature, population density, NDVI, and other environmental data set. So the approach that we normally use, you try to integrate these two data set, because surveys are sampled. So you might have a point where Sophie is sitting and then another point somewhere like maybe 2 kilometers from here. But when you come to geospatial covariate, we have data. So that's the approach that we use to come up with the estimates. So over here, I'm just presenting or showing some examples of the geospatial covariate from different sources. So just a quick overview. Normally, this presentation takes a lot of time, but I want to just try my best, not to go into the technical terms. So what we do, basically, our approach, I'll just go to this wonderful figure. So we have a DHS data set, and then the different geospatial covariate as our input to the model. And then we fit a model. So our modeling approach, for me, I can say is very simple, but basically straightforward. So what we do, we fit machine learning models. We call them, there are different machine learning algorithms that we use. And then once we fit the model, and then we have now our final model whereby it's an ensemble. So the output from the machine learning techniques is used as an input in our model. And then, of course, we use like a Bayesian approach to run these models. And the advantage now why we do this one, because if you use one approach to do your model, each approach has different output. But if you do like the ensemble, at least, you are sure that you're coming up with a very good estimate. So for people who have some ideas of geospatial data set or GPS data, so we have a point here and another point here. So one approach that we like to include in our modeling work is the term called spatial autocorrelation. Basically, we want to take into account if 2 points are close together, they have similar characteristics. That's how we take that into account in our modeling. Anyway, I don't want to talk too much about that, but in the end, we produce now estimate at a pixel level, and then we use population degree data set to produce now estimate at a admin 2 level, which now is very, very useful for countries for making a decision. So in our work that I want to now finalize, so we were able to model different function difficulties. So one of the indicator is those who have some difficulties. Those at least have a lot of difficulties or any difficulties. So all the different function disabilities, we're able to use this approach to model them. And as I said, this data is from the DHS surveys. And we did for South Africa, the survey that was conducted in 2016. But I think our approach also is to our goal is to see if we can also model other countries, even those from the recent surveys. So this one is just showing some variation of the different areas or estimates in the country, the admin 2 level. But also we are able to make a comparison with the direct estimates. And of course, as you can see, we see like there are some similarities, areas whereby we have higher modeled estimate is the same. Also, we have higher in the direct estimate. And my last slide also here is trying now to bring in the data set, because we wanted to see for those who are having any difficulties in terms of education, did they attend school? I mean, do they have education or not? So the advantage of our approach now, at least you are able to mix or combine data from different levels. And the last slide here, I think that's the last slide, but this for sure is the last one, showing now again, admin 2 level rates for any difficulties, again, trying to compare also with the community data set. And so this is something that I wanted just to share with you guys, but there's like a lot of work that is being done, and we have done for so many other indicators. And countries now, they're like demanding admin 2 estimates because it's very useful for them for decision making. And our approach can be used to any indicators, not only the DHS indicators, but mixed data set, but even other data set that they collect the GPS location, we're able to use this approach. Thank you so much.
For your intervention. And now, without further ado, I'm going to give the floor to Sophie, who is the organizer of this event, at Professor of Economics at Fordham University. She's also the founding director of the Research Statistics Consortium and the founder of the Disability Data Initiative. Sophie, the floor is yours.
Okay, hi everyone. So I'm going to present on some of the results of the Disability Data Initiative on local statistics. So if you're not familiar with the Disability Data Initiative, it provides analysis of disability data to help advance human rights and sustainable human development for all. It is an interdisciplinary and international team of collaborators in Africa, Latin America, Europe, North America, and Asia. So I'm going to share with you a database. So if you want to, while I'm walking you through some of our results, the database can be accessed on the website, and you can maybe play with the website on your device. The website is disabilitydatainitiative.org. And on that website, on the upper horizontal menu, you have databases. So if you click on that, and then you click on Disability Statistics Estimates database, then you're going to be on the database that I'm going to present. Okay, so what is the Disability Statistics Estimates database about, or DSE? It was created to produce estimates of disability inequalities across countries using internationally comparable methods and data. So it's a novel database and grounded in human rights, in a human rights framework. So far, we have results for 40 countries, and we aim to add results on a regular basis with the goal to add more results this December. So our results come from analysis of population censuses and household surveys. So it's basically disability disaggregated data, but you can also narrow down to population subgroups. So if you're interested in women, you could have disaggregated data for women only. Or if you're interested in older adults, you can focus on older adults. So these you can pick, so these population subgroups of interest, you can pick them on the menu on the left-hand side column. You can also pick your, so of course your countries of interest, your indicators. So we have 29 indicators on prevalence, education, personal activities such as employment, health, standard of living, insecurity, and multidimensional poverty. And on that menu on the left-hand side, so the screen you get on the default screen gives you national results, so cross-country estimates. But if you're interested in within country estimates, then you can pick on the menu at the top, estimates within countries. So for instance, if I'm interested in Guatemala and in understanding multidimensional poverty among adults in Guatemala, so then you pick Guatemala. And so this is actually what the this is a map on my slide is a map of the multidimensional poverty rate for adults with disabilities in Guatemala. So this map shows a lot of variation across region. In fact, the poverty rate among adults with disabilities ranges from a low of 20% to a high of 80%, I think. So a lot of variation with much higher poverty rates among adults with disabilities in the north compared to the south. So this information is also available in a table format, if that's your preferred format. And if you really want to zoom in on particular districts, so we start with about 20 regions, and then we present statistics for districts. So we have hundreds of districts, if I'm not mistaken. So then you can also get that information for districts. So on the screen is a screen. You have a screenshot of the district level results. So you have the results accessible through an interactive platform, but if you want to do an in-depth analysis, you want to do research, maybe map some of our results with climate data at the district level, or maybe citizen-generated data on accessibility at the district level, then you can download. It's better if you download the data set. So this database includes subnational statistics for adults with disabilities and subgroups of adults with disabilities at the first subnational level for all the countries in our database so far, and at the second subnational level for a subset of countries, those with census data. So we think that there is a lot of potential in terms of informing policy and advocacy at the local level with these local statistics. And we also believe that there is considerable potential for research in terms of merging these local descriptive statistics with other data sets to understand. So right now we're only describing what's going on at the local level, but if we want to understand perhaps why in some districts adults with disabilities are more often employed than in other districts, perhaps merging with citizen data or environmental data can help us identify environmental features or policies or advocacy campaigns that helped in terms of reaching these better outcomes. So this is quite new. Our database is new. So if you want to be in touch or if you have comments, the email is disabilitydatainitiative.help@gmail.com. Thank you very much.
To see how this initiative has grown and will continue to grow. And it's a tremendous amount of work to do the background for this type of databases. There is a tremendous amount of hours calculating and reproducing the numbers. So kudos to you and the team for having taken on this very significant undertaking. We are not doing too bad when it comes to time management, not thanks to me, but thanks to you as speakers. So we do have now about 10 minutes, I would say. We want to be on the safe side for some questions, and there are already questions in the online, but please do feel free to add more questions. Obviously, participants are eager to know if the PowerPoint presentations will be made available, so which I hope is gonna be the case. And there is a question for you, Dan, on the teacher version of the CFM. And particularly, how can we make sure, can we trust teachers' assessment of students? Because sometimes teachers operate in very, very difficult environments where they have a lot of children, and also data collection is not their primary motivation, right? So filling a questionnaire and providing information about children might not feel like it's part of their job. It's an additional task. But in some cases, the reality is that teachers might be having classrooms with 40 kids, 50 kids, 60 kids. How do we know that their responses are actually valid And would we compare these responses to the responses we will get from a household survey?
Well, that is actually how we tested the CFM TV. The assumption was because the CFM had been validated well, that were the teachers giving the same responses as the parents, and that testing went on in several countries. The interesting thing was that there was a great deal of agreement, which is the reason why the CFM TV was launched. The one area where there was less agreement was in learning, where the teachers identified more children with difficulties than the parents did. But if you think about the situation of being in a school versus being at home, and what a teacher's focus is on, that kind of makes sense. Now, when we actually administer it, I think you get better quality data if the teachers think it's going to be used. When we tested it in Belize, the idea was that children, what they were aiming for was children who were identified as having difficulties would get referred to services within the classroom and for the students. So the teachers are very motivated to do it. Second, the teachers aren't doing it just one time and it's gone, right? They're doing it over and over again. So they have experience with it. Another thing is, when in the school year is it being given, right? If it's given the first week of school, they're probably going to under-identify maybe not the children who have difficulty walking or seeing, but the children who have other kinds of difficulties. And yes, the larger the classroom, and if I have in Belize, the classroom size was like maybe up to 30. The teacher, knew all the children well. If the classroom has 80 or 100 children in it, then yes, the quality of the data is probably going to be less, especially for the children with those learning developmental kind of difficulties, as opposed to the children, say, who can't walk or something like that. Yeah, so nothing's ever perfect, but I think our experience with it is that it is a useful and effective way of collecting the data.
Changing a bit to that, if I, right? Sorry.
Please.
So Dan, yeah, I wanted to just interrogate a little bit more. You had touched on data on the environment, and you had said, accessibility, disability-specific supports. I wonder if you could talk a little bit more about the culture of this school, the culture and the level of inclusion and belonging, and how my challenge might be that how teachers might assess that could differ from how a child with a disability might assess it. And one of the things that we know from research on educational leadership is that if a child believes that their teacher thinks that they can do well and believes in them, they're more motivated to do well. So all of that, I think, probably can't be incorporated into the future versions, but just wonder if you might reflect on that a little bit.
Yeah, well, the MS it's distributed to teachers, right? So the child's attitude, that's not going to be in there. And even the attitudes of the teacher, I've never seen an MS that asks about those attitudinal kind of things, which are important. They're also really tricky to ask about. Claudia can back me up on this. When we were developing the inclusive education module, they had to dump a lot of the attitude questions, even though we thought attitude was important, because it was so hard to word them in a way that was getting at what we wanted. So the question was, for example, should children with disabilities go to this community school? What do you think? And some of the respondents said no, right? And then when you did the cognitive interview, they said, well, in a perfect world, they should go to the community school, but that school cannot handle them. The people in this community are going to bully them. So yeah, right now in today's world, I'm not going to send them. So the question wasn't getting at their sort of vision of rights. It was getting at their view of what was going on. So it's really hard to get the attitudinal stuff.
Also, if I might add to this, I think the purpose of this reflection today is really to show the complementarity of the different data sources, because we cannot just rely on one data source and one respondent to get a picture. So these type of questions, for example, and understanding might come best from qualitative research. And qualitative research is not a second class type of data sources. Can be actually very important to understand how and why certain things happen. So it's really looking at these different data sources to validate, but also to enrich the data coming from more traditional type of data. Yes.
How you doing? My name is Shir, and I was listening to the question and thing I answered, and I remember that, of course, I'm African American, have been to Italy since I was young, and, I learned about the Pygmalion effect, where the expectation that someone has on you, and then you derive that expectation of yourself, and I think that is what you were saying. But I think you have to balance it. Well, what you were saying, you have to be pragmatic. You have to be logical. And not just heart filled, but you can't just go with reason and without a heart. So you still have to be balanced, and sometimes you have to make tough decisions that you won't sleep well at night because they don't go well with your heart. But you know soundly. And I employ your courage as well, because it's not an easy thing. So do what you want.
Thank you so much for your call.
The host is moving and unmuting, so I don't know how this is happening, but
You're multitasking. Thank you, Ben, for lending your covering the technical aspects of logistics as well. Any other questions from the room or online? In the meantime, I want to acknowledge Cameron comments in Pakistan. Disabled children also need references from persons to get admitted in government schools. So any other question or comments? No more questions or comments?
I think so.
No, I was saying this is right now.
Oh, okay. All right.
A couple more questions.
Feel free.
So, I was really interested, I'm sorry, okay. I was really interested, actually, you're gonna have to speak next, on your presentation around geospatial data. And I wonder, I'm just trying to think about, how the geospatial data connects with, let's say, the MS data doesn't. And, I wonder if you could reflect on that a little bit, like, how do we come up with, actionable data if we kind of look at different data sets?
Education management.
Oh, yeah, sorry. Information.
The Zoom is gone.
Oh, really?
Yeah. It's connected here.
Oh, so then let's use Claudia, you still connected?
It's still connected?
I am. Would they give us a background?
It's okay. So now I work for UNICEF. I don't have a job. Okay. Yeah, so just to respond to the question, so the good thing with the geospatial approach, we can use different data set. So if we have the MSA data and then we wanna use it, I think it should be possible. So there are some challenges in terms of technique, but I think just overall, yes, we can use that particular data. And I think in my previous work with the University of Washington in Washington, in Seattle, we had used the same approach to model education attainment, at a lower level in Africa, I think for a span of like 10 years. And that was like a very useful information. Yeah.
Can I say, just the idea of linking up data sets. So like in Armenia, they've linked up the MS with the social welfare administrative data set. Right? So they can say, look, we have a child receiving disability benefits in our system. We can see, oh, how is she doing in school? Uh-oh, she's not in school. Right? So because you have the two together, they can use it. So same thing with the geospatial data. I know where all the schools are physically located.
Mm-hmm.
And I can say, oh, I have all this information about the children in the school. Well, what do I know from the geospatial data about the area that they live in? Because the MS isn't going to ask questions about what's the average income in this area, or, what's the rate of, what's the age distribution in this area? How many single mothers are there in this area? EMIS isn't going to ask that, but it could link up with the geospatial data to do that. Thank you.
For said disability or challenge.
Okay, so I'm gonna repeat, your question is how do we actually come with this label of identifying persons with disabilities?
Yeah.
but the curriculum, like,
Curriculum, like.
Oh, you're talking
like
about the
once we
curriculum
Already
for the
diagnosed, we
children.
have who is problematic or now they have to have education, they have to live normal lives, at least normalcy to them. So how do we come up with a curriculum that does not separate them, but keep them on the going path, because they're human, they have to live with them. So,
Really important questions, but that's for a
No, I
session on
understand.
education. But hopefully, if they have this kind of information, it will help them in designing it and also help them in evaluating it, right? So they say, okay, we're gonna put this new curriculum in here, this new flexible curriculum, because we think it's gonna be better for children with disabilities. Well, if you have the MS monitoring those children, you can say, oh, look, we started it this year in these districts, and we see an improvement. So we have proof that this should be scaled up.
that was my intention, you answered it.
Okay,
So we have two more questions and we are gonna close after these two from the online participants. Any data on access to transport and finance? And then the other question is, are the speakers aware of any example of administrative health data sets that use functional impairment to identify disability as a replacement to using household disability survey to estimate prevalence?
You want to start then?
So to repeat the questions, are we aware of
So the
any
first question-
health system data on functional impairment?
The first question is, any data on access to transport and finance? And the second question is, are the speakers aware of any examples of administrative health data sets that use functional impairment to identify disability as a replacement to using household surveys to estimate prevalence?
Mm.
I can take the second if you
Yeah,
want.
okay, sure. Yeah,
First.
on access to transport and finance, I'm not aware of detailed data sets. There are some surveys out there that perhaps may have a few sets of questions that ask about people, whether households have a bank account, access to savings account. And on transportation, maybe some modules that include questions about difficulty getting to the workplace. So that relates to difficulty on transportation. But what I would like to stress is how the local data we now have, whether it's from the descriptive statistics from the disability statistics estimates database or from soon modeled estimates using the DHS and other surveys, how that could be matched with other data sets. So other data sets that may have detailed information on infrastructure or transportation or perhaps availability of banks and so on. So perhaps that way we might be able to get more information related to access to transportation and finance at the local level.
Just very quickly, the United States has the data, FINRA data, that has data on the financial capabilities of and savings rates of things of people with disabilities versus people without disabilities. So that data is available in the US.
And let me step in to answer the second one. So example of administrative health data sets. Well, the first thing to say is that administrative data are not meant to be used to produce prevalence estimates on the number and percentage of persons with disabilities, because obviously, again, administrative records are data that come from service users, those who are in contact with the services. So not all persons with disability use the services that are provided by the health systems, and therefore it shouldn't be really thought as a useful source of data. In this case, household surveys are the source of data, right? Because as similarly to the case of students, if we go through IMIS, we only capture the student population. If you go through a household survey, you might find students, meaning those who go to school, but also those who are out of school. So we have to think about some of the possible restrictions that pertain to administrative records because they come from service providers. So only those who receive these services are captured there. Obviously, we encourage still the use of functional approach, even in the context of health records. When somebody's go to see a doctor, a hospital, a nurse can record information as a first level of screening, but also we need to think about doctor and nurses. So when they receive a patient, they will look at the patient and ask questions that pertain to the response they are able to provide. So which is very much related to, for instance, impairments rather than a broader assessment of a functional ability of individuals that have an influence, that are influenced by the environment. So just to say that regardless of whether or not this is available, there is this important consideration of how we can use administrative records with the necessary caveats. So
I was working on a data harmonization program in South Africa, and the health management information, the doctors were collecting all this functional information in the process of reviewing, but they weren't recording it in their data set because the only thing they were recording were the diagnoses, because that's what was important for them, right? So what we were trying to do is say, okay, we know the diagnoses are important for you because for medical care, but keep the functional information as well in this data set so that we can compare it. So for example, if the national household survey says that 2% of the population is deaf, but you look at the people who are coming to your services and you find out there's no deaf people receiving healthcare, you can say, oh, something's going on. We have evidence of a barrier. We can use the two data sets together.
We were doing so well when it comes to time, and now we slipped up a little bit, probably because I also took the floor. So it's now the time for some concluding remarks by Minister Hildegard Naughton, who is Minister of State at the Department of Children, Disability and Equality. Thank you so much for joining us, and the floor is now yours.
Thank you very much. It's my pleasure, and I'll try and keep to time in the wrap up. And just to, first of all, I want to sincerely thank Christian Blind Mission and the UN Global Disability Fund, two really important partners for Ireland's international disability inclusion work. And to really thank you for all of your contributions here today, really insightful and at times very powerful contributions. In relation to the importance of getting that data. As a minister with responsibility for disability in Ireland, we're grappling with the same issues around collecting data, mapping our country, and being able to, I suppose, raise awareness for people and families with a disability. This is where you go in your area. This is how you access these services in your area. I was previously Minister with responsibility for special education. So many of the questions here that were raised around education, really important for every country and for all of us as policymakers to make sure we're getting the correct data and we're asking the right questions, I think is really important. And I think the issues raised around cultural problems, attitudinal issues, they're right across the world. In relation to how we deal with that. Just really briefly, from an Irish government point of view, we're currently working on a national disability strategy. So this is all about data collection as well, but more importantly, working with those with lived experience. This is not government coming up with the strategy. We're working really closely with leaders in the disability space in Ireland, many of them who have travelled here to New York this week to be with us. They have fed in directly into that strategy. So it's everything we've raised here today about getting a job, someone who has a disability, but sometimes the job is not the problem, it's the transport to get to your work. It's also sometimes the problem of the employer not feeling supported to hire somebody with a disability. There's maybe a cultural changes there. They need more supports, more financial supports to help them in that area. Independent living, special education, access to healthcare. And I think Casper really, gave us a very stark example of the importance of data, of breaking down barriers and enabling people to live independently, to have access to healthcare, and looking at those most vulnerable in our societies and how we as policymakers can help support them. So this has been really, really insightful for me. Thank you so much for your contributions and everyone who has joined us online. Thank you.
Thank you so much, everyone. Thank you for your closing remarks, Minister. Thank you, everyone, for participating. Thank you, Sophie, for bringing us together. Thank you for those joining online, including the sign language interpreters. The meeting is closed, and I hope you're going to enjoy the rest of COSP. Thank you, everyone.